Ublatsiano Nubumute, Ublumi 12 Nutat, Nuban Naryakak to Nubuiloni, 8 Anya to Nuban Naryakarunya to Katilukta 78 Nubuiloni Nuban Naryakak, Amatakwa Tamami Tabania Kaluni Shuti. 145 Nuban Naryakarunya to Tamang Nuban Naryaka Laukamang Matabania Kaluni. Ublumi Tikid Ligutako Nuban Naryata Rikatimi Kapio Himayut. He would look at me Kapio Himayut 16,609. Makinudleni Kapio Himayut 13,160. When Kunitana Nahout Ublutama Kubak Pada Royakmat. Mat Nawatung and Nubud Mute Koyalim Martung at Aqua to Hilma Chata Sutit, Nala Chata Sutit Aqua, Anya Feditici Malik Takoyangini. Kawima yung tahan ayong nangit ayong natuk yuman ubdaliwan yu katingawan yu kihanita ko malilaw malit chalal wata ko malik ta ko yo katingaluak tangin luta unga higtigi taluta ubdaluk tangin luta agawa me cha taluit kina pakhimat taluta aniga ta ko matwani tamap taluk ta ko nala cha optigo kalamiuna khatana nuban nagya ihuliluni nungun naman Tabania Kalung Niki Himan, Nuban Nayo Akman, Kihenakawiman Nahuitu, Nuban Nayo, Nunaling Mutike Latua, Tike Latua Hinakamakwa, and Natali Tichiku Malik Tokoy and Bali Luktalo, the wood, Nunavumi Lukta. Ani Tan Yakalung Nutorangayo, Yakalung Mute, Yakalung Muted. Katinga tangi lauta, ai hima laurichi, ai hima yakakalwarapta, tana nuwan na ublutama na hautit nutaang ni taika hakti naktamata, tana inung atau hikana ma inung mukihani au laso ni angi libada rawi hauman, takwa malik tau kayo malit siya law labun, ai hima lauta ublaluk tangi luta, tana kuwe hugyakso katinga tuta party tangi lauta, tana hanan na ng yellow ming mat dahil ko part ako yung mata nalat chelo labun taabong alukta ako niyo na katanuban na yo au lapat ta ko kwa khimani taabong alukta taw pinawing mata nuban na yo kilamiyo na kanungupat kilamiyo na khata ko ukwa palya awang na mata kuna lukta nunulilwani nalat cha ta mata nunumiyo mat na khimat cha mapaka Makalug mute, Nala Chella level, how you mayunga, Takwa Halagania, Tigutan, and Nuan Nalya, Malik Chow, Tigutakwa, Malik Takoyo, and Nataliti, could not know you. Today we are reporting 12 new cases and 8 recoveries of COVID-19. There are 78 active cases in the territory, and all of them are here in Iqaluit. There has been 145 recoveries since this outbreak started. To date, 16,609 Nunavut received their first dose of the Moderna vaccine, and 13,160 Nunavut are fully vaccinated. They have received their second shot. I want to thank all Nunavut for their continued patience and adherence during the latest outbreak. Thank everyone for doing your part. And we all have to do this to get it done. We're all tired of these restrictions, but we have to stay focused and strong. We can do this. Everyone has to do their part. Ask for help if you need it, and we're all in this together. And let's protect one another. Mask up when outside your home, always. Stay home as much as possible. Keep strict social distancing with people outside your household bubble. Get vaccinated, do the right thing for yourself and your family and everyone around you. And I'd like to emphasize this here in Iqaluit to the strongest I can. Stay home, don't party. That's the only way that this COVID will be beaten. We have to stay home, don't visit, don't party, don't socialize. We can do all of that when the COVID outbreak is over. I thank everyone for their patience, understanding, and for the ones that adhere to it. Thank you very much.
Morning. Ublakut Nunavut miutau katika. Tamna pinasawa ko sa rilok tagot na yanguan ilitaksin ng itukaga kalauman. Sibudlang ko yan na mayroong mablugit. Anyak tilaga ng mul. Anyak tayo limayulaga ng mulo. Minister tilunga. Tayo ko na yanguan tamang mi. Nunavut mi. Pilaga kataktun. Takayuit tuya katang mata. Takanaktum makayaw may pilaga kaktilugit. Nuwagjuang takaktilugo. Kasi na nuwagjuang ni asingin niktaw pilaga kayo ng mata. Ko yan na may makayalo yusi. Manayangwang ni pilaga katakakpagtusigot. Let me begin by wrapping up the National Nursing Week. I just want to take this opportunity to give thanks as Minister of Health to all the hardworking nurses on behalf of all Nunavut. Thank you for everything that you've been doing, not just in this pandemic, but you're dealing with all the other issues around healthcare for Nunavut, and you're doing a terrific job. I thank you for that. Tadlimani pinasawasan ni tamatuminga nuwagjuang nami ikalog ni pilagaya kalagapta ikaiti taungin naktugut ubduta mga kasatsiyak taman na iso kagaya kakalawang man maligaya kakalawang aptiguta magkuha nahalagtaw ko yaw yun taman na siya magpalya yun ni kuguptigut nunabumi ang mapiluwak tumiman na ikalong ni nahalalawak tatok. You know, we're heading into our 5th weekend of this lockdown in the capital. And again, as the Premier and the good doctor have done on previous days, we have to start listening to the rules, to start respecting one another and do our turn in helping to put a stop to this pandemic. It's really quite simple. It's time we start respecting them here, especially here in Iqaluit as we go into week 5. Kaway mayugod o kawjawin naktugut o kalay naktugut away kitu makikiruna amigapta away nung palyan lianing mingman katiyuman naksa katang maaway akut ane katigig duni iga katigig duni katigig duni do tayo man na ileo ko magupta maan na katikatangit kalaw kaya kaktugut imiriaktok biwuwit maan na ungit turlugit abi si madjumi kaya kaktuguman na sila milun ni kating nakatigilo kaya kangitugut maan na tamagkuninga matuarnik ato katagaya kakaluak tuguman na sila may pilirin niya kaangap. Tapi yung niya ako talun ni nutak kabudlo sila may ang utak po aningwang niya kaangata tamak kuning amatuang nito nilugit itikangata agangir mitidlugit sigalini amit kakata kakatangit luta imiyalong niglo tamak kuning aglana redyutinik pagkuyang ni pilaw tinik ulunik amit kakata yakan kaluak tuguman na piluak tumik. We have a very short summer, and it seems it's getting shorter by the day. You know, if we want to have our usual summer parties outside and gatherings outside, for Iqaluit and everywhere, but especially here in Iqaluit, it means stopping your gatherings now. If people want to come to your house for a party, tell them to go away. Come back in a couple of weeks. Stay away from going to parties yourselves. Don't hang out with people in your house, from outside your household, in your household, or in their household. This is pretty simple stuff. This has to stop. Don't go outside without wearing your mask. If your children and children under your care are playing outside, ask them to mask up. Get them to wash their hands when they come in. Don't share your cigarettes and tobacco products and drinks and utensils for food. These are very simple stuff we should be doing if we want to enjoy the short summer that we are about to have. It's up to all of us to do our part. Please don't take chances and think about all the others that are listening to these rules in hopes that they could have a very good summer. It's still not too late. Let's be strong and let's be vigilant and careful. We know what we have to do. Let's all stick together and listen to the public health measures. Tamakoy lam nalag lutigo galoang naalang isarangap tigut ako nikan nituin na ingi kanea mataman na nuwag juang na isulit kugup tigut uvagut tau siwumut ablo kaya kalak tigut naalag lu tigut tamak ko pitele ko yawyut amma ato ko yawyut ato tiyalu tigut aw yakat tiyang nayakap ta nunavut miyo tigut saalagi yun nakta bununa ikalong miyo tigut saalagi yun nakta siyuna ilay katigikup ta. Thank you and let's have a good weekend.
Good morning. Unsafe gatherings continue to spread COVID-19, whether it's parties, playing outside with friends from other households without wearing masks or visiting in homes. We are seeing continued exposure to COVID-19, continued spread of the virus, and more people having to isolate. Through contact tracing, we've identified gatherings of multiple households that resulted in additional cases confirmed in children, and 3 households having to be isolated. As of this morning, we have 264 people in isolation in Iqaluit. The more people who must isolate due to exposure to COVID-19, the greater the risk that essential services will be impacted. Isolation also puts additional stress and burden on families and the community. Health staff are working hard to help stop the spread of COVID-19, but this will not be successful without everyone's cooperation.
Ulla sakut ulureanak tumituti suli katihattartu tamannaseer mapalleagutauyoq numadjuanak 19 mik taakua katihatigitsuti imiralakhatigithattartun ammalu surussi aniinguakhatigithattartupi khatiminik illumiukhatiginngitaminik ubbalu pulaareakhattartu taangiqqaringitaminun sulitakuvalleakhattartugu katitsikhattartuni numadjuanak 19 linnik tamannaluseer mapallealluni numadjuarnaq taakua illumi ila anitteiligaaliminiugaluanuk anitteilinninngittunun katiyauyiminernaqauyisarnikku nalunarsisimayugu taakua katirattartuminiuninginni illumi oqattigiingittu amissut taanna nufatjuanaq taarutaulaqikkannersimayu surussirnut ammalu pingassuni illumi oqattigiini taakua anitteiligaaliminerni ullaassamunut 264 taakua anitteiliguyaussimayu taakua amisuunursa anitteilissimatilugi katiyahartuminiutillugi nuvatjuanarmik teema ulureanartumiinnersaugunnaqqu tamakkua pijitserautiullarigiali attortauniqarajarninginni anitteilit taamannattau tahargutaussimamat ammaluuhumaittukkuurutauma ilagiinu nunaqqatigiinullu taakua annaharnangittuleriyuk iqqinajartinga atsuruutilimarialuummata noqqartitsigasuartutik saarmarpallianinganik nuvatjuanaq 19 kisaani tamanna
I also ask for cooperation with surveillance testing. We have had many individuals refuse swabs because they are afraid of being isolated or feel that it is unnecessary. Surveillance testing doesn't mean that you will be isolated. Isolation will only be necessary if you test positive for the virus. This is what makes agreeing to surveillance testing so important. If you are asymptomatic and positive for COVID-19, you may be spreading the virus. If you have COVID and do not isolate, you are putting other people at risk. I know that no one wants to isolate, but it is the best way to contain the spread of COVID-19. And as long as people continue to gather in unsafe ways, the virus will continue to spread.
Apirimmiakka ikajohatauhullugi tamakkua hauyissartauhattartu taakua amisuarti taakua ripilutsimamata hauyissartaugumayugalua taikkua kappiasuk ila anitteiligumangginnikumut ubbaluni teemeigiahartsurinnating taakua hauyissartauhattarni tukihangit ila teema turaatuinnatjaangittu anitteiligujaunermik kisiani anitteiligaaharayartuti taarna naluneertauguvi nuvatjuarnartuqarnernut taimei maangiqattarlussi hauyissartaugunnanammu tamanna pimmariuvu taima hanuigutiqanngikkaluaruvit ammalu nuvatjuanaq 19 qarniruvit tamatumiingassaarmarsivalliagunnartuti nuvatjuanarmik Nuvadyo anak to hang Ruvit anitailing ikubillo asindik inuhatin neulore anak tumitit sivutin. Kaya magalawak to ngakikuli maanitailing umangin mata. Kisa anitaman nakaw na pang masayang mataylitit sinemo nuvadyo anak 19 mik. Tamakko akikutuin na isuli katihatang na katulore anak tumitit sinikko taman na suli sayang mapaliatuin ng na akto nuvadyo anak.
Ken Driscoll, APTN National News. My first question is either for the Finance Minister or the Premier, depending. Nunavut is calling for mandatory paid sick leave for Nunavut employees to help stop the spread of COVID within workplaces. I'm wondering what's the government's reaction to NTI's suggestion?
Ken Driscoll, APTN kunni. Ako Nunavut tungawikut akilaswi huyem mata khani matilugit ang ikas magyahak tilugit aman nanukhat tita hulugo sa mapalyanik ikhanaya kaya na hatam na ng mata khano tamakwa gavamakko tamatumwa Cuban.
We're looking at the options right now. We haven't made a decision yet, but we're looking at options. We also had the federal sick day leaves that we were looking into too. So. No definite decision has been made yet, but I agree that if you're sick, we ask everyone to stay home when you're sick, so we're here to help. Dan man huli himalyo khimang itabutan ay himalyo ila anya o very himalyo to akilak to lutin. Takwa NTI could kadima katigim malugi pinak tabo hulitana matam government toka kunitana ta hakka tawlak man kihani man na mo ihumaliok himang ito.
And my second question is for the Justice Minister.
Hickes.
Minister Hickes, earlier this week when there was the rollout of enforcement here in Iqaluit, there was some confusion early on with calling our CMP dispatch in order to send people out for COVID enforcement. Now it seems that that's mostly resolved by the end of the week. I'm wondering what was the nature of your government's discussions with the RCMP about this, and what did you guys eventually come up with to allow for RCMP to respond to this?
Minister Hickes, pinasa ako si Piga katatilugo. Taman na malitaw kay gaham ni Hostel la yung may kalunni takwalo nalulero sa hatta yung matapalisik kuno kalaga ang mga tamakwa no vadyo ang misa matelitit sinamo kano kakatigilaw kasi palisik kuno tamatumamitsano.
Thanks for the question, Kent. And it wasn't so much a discussion with the RCMP, it was a discussion with all the shareholders, with the City of Iqaluit, the bylaw, the Sheriff's Office, Wildlife, liquor enforcement officers, as well as the RCMP. One of the challenges that we were faced right out of the gate when the pandemic hit Iqaluit was the volume of calls at the RCMP. They had some staffing issues, obviously, associated with isolation protocols and other factors where when we look at a call, triaging a call similar to a health center, you have to determine what is an emergency basis. If there's an ongoing large gathering that the RCMP need to deal with immediately versus somebody questioning. Sorry, thank you.
Kuya nami taman na kakatawlo alaw ngito galwa kisa ni tamakwa pili kay katigi ito kanaya katigilaw nga tasulos sidik kung ikalunni maliga kala ni malitaw kay tamalo kakto ibin mitako palising wangu ni kaktaw yi palisik kullo tay matsom na saw tigilaw nga tamani pilo akto mi ikalunni siya mapalялak tilugi palisik kullo kanaya tikit sa mo tamakwa la ni tayligalin ni kamagya kalilaw nga ta ukala yun nalla sibuliga ham mga ta nalo na taw katang ata nalla to avam nang naksaw katang mga ta tay makamakata hangata sule
versus the appearance of somebody not adhering to isolation requirements or not wearing a mask would be something that bylaw or the Sheriff's Office or another law enforcement agency would be able to deal with. So the triaging of calls is obviously was something that was challenging out of the gate. Mainly due to capacity issues. So those issues have now been more or less dealt with. There still is a priority. We have to remember that The ops that take the calls here in Iqaluit take calls for all across the territory when our communication system is working appropriately. So I just want to really encourage people that if they are going to call into the RCMP, to make sure that it is something that is an urgent nature, versus they can contact other law enforcement, whether it be by law or sheriff's office in a non-emergency way. Thank you.
Takoila hauisak tau hatara hangata nalla sivulliu jauge hammangata suullu matuarsimangittu ni naalattu harningippa tamakkoa bailaakkunnu ilangi kamagiyau hattarunnangata takko sivullipa matsuurnarutiulaungata tamakkoa liqqanayartikitsalaungata kisaini sivulliu jauni usajougalua takkoilu palisikku haalaviu hattangata tamaungat Nunavuli maamiingaartunik Pimmariungitoa kapalisikkunnu haalahattangillussi tuavernangitoa qatassinginnu suullu bailaakkunnu ruballuiqqartuiyarala palisinguanginnu haalangaahattarlussi.
Jackie McKay, CBC News. As your role as the finance minister, I'm looking to ask you some questions. 2 weeks ago, I asked you how much of the contingency fund has been used for this outbreak. I also requested those numbers from your department, but they haven't answered my emails. So I'm going to ask again how much of the contingency fund has been used for the Iqaluit outbreak.
Jackie McKay, CBC kunni makupinosaarussi aperiujaati minister tillutikinaw yalerikkunni takwa amiak ila nalliukkumaatsa ikinaw yatortutsa yakhanutiga tortaussimalikqa kiujaulaungin magguutaanna kisaani qalunni qatsinginni atorsimaliqqiullumimu. Slow down with your talking, okay?
Thank you. Thanks, Jackie. And I do apologize if there hasn't been a response. I'll follow up with my office to make sure that that is remedied. I did want to clarify, when we talk of a contingency fund, from a government standpoint, as I'd mentioned in my budget address, we have this year allocated a $75 million contingency fund. To date, we haven't touched any of that. Now we will have supplementary appropriations likely upcoming in the near future during the next sitting. But when it comes to the contingency fund from a government overall, we haven't had to tap into that for a COVID response.
Tanna ilama mehan allabingani kiujaulaunginnavi tamanna tokisinartigiarlugu taakkua nalliukkumaatsa ikinaw yatortutsa Nunavut gavamakkungin suli atortaulaungittu tabbani aqqaagunginni 75 million sanirbartaussimayut kisaani nalunangittu qaakkanningagu ilagiarutina atortutsani tutsiralaartugu maligaliorti katimalermippata kisaani taakkua nuvajjoanartulirinarmu nalliukkumaattulaungitavussuli.
Thank you. And the recent money we received for the COVID outbreak from the federal government, do you have a further breakdown at this point?
Takkoili kiinaw yartaariqataalaortassi gavamakktorhakkunni qanu akkutorsimaniaqaat.
Thanks, Jackie. We do. It would probably be better to give it to you in a written form. I do have the different. Some of it's in kind. Some of it is. There's multiple federal departments involved with the funding. But just to give some rough numbers, and I'll give this to Uli right away. Social supports, $4 million. Educational services, $1.5 million through Nunavut Incorporated. Healthcare supports in kind, a little over $1 million. Correctional supports, approximately $500,000, mostly in kind, through the federal corrections waiving their fees to house our inmates. Daycare supports, a little over $1 million. And then expanded broadband for Nunavut Arctic College, about $750,000. That being said, with the announcement just being recent and so many different departments involved, it does take a little bit of work to put the pieces where they belong, and we do look forward to enhancing our announcements, I guess, of providing more detail.
Tako titerassimatillugi tuniyappa takaunarsaauga jalortuugalua kisaani tamakkua kiinaujaqtiguungangittu ammaluatsigiingittuni gavamatoqakkun ileriviinginniingaarsimayu kua ilangin inulerinermu Iqaluit 4 million ilinnaatulerinermu pijissirautino suulu angiqarsimayunu ilinnaartitsinermu 1.5 million nunavutungavikkumni takua annaaharnangittulernermu Iqaluit suulu tamakkua timimu sapummiyaugutinnik 1 million ungatanut. Ikayok tau vinoy kayuti 500,000. Pairi vinoy kayuti 1.1 million. Amalo karisayok ikakivik kurutinun sila to sabi mo 750,000. Tako naluna yaktaut siya kanila to hanatok tau lang mga takinaw yay.
I'm a contradictory first. On Wednesday, you released vaccine data by community. You initially said that you wouldn't be releasing those numbers. What changed?
Nama Toronto Canadian Press kun pingat sa minaluna sila urat siya kano tigino nalin ni kapayaw sa mga atas sumalita masakit tao kung naksitalaw ka.
There was a number of things that led up to that decision, basically, we knew we were going to have to release them sometime after the end of the last of the mass vaccine clinics, and it felt that that time was right.
At sige ito na pidyo te kalaw tutan na sakit tao laki lilaw ni kanitigi kapayaw si mga ata kisa ni sakit ka niu sa tuwi na law katigo kingulak pa may so ni kapisikat talaw tilo tani.
Can you give us an update on the 4 people in the hospital in Ottawa?
Tako kaya sita maarawa mo kaluna ano awlak ti tao kaya kaksmayohan nabi mo.
It hasn't changed since Wednesday. 4 people have been medevaced, 2 have been released from hospital, 1 is still in a general medical ward, and 1 is in intensive care unit.
Sula si Jing ito tako sita may mako anabi mani si malaktuk ay paunit si matuin naktuk ay painuli saktaw vi anabi melu anabi alumito sule mako.
Dustin Patarnan, NSF News. We are now exactly 1 month since the first case was detected. Can you summarize the last month and where are we in terms of how things are going?
Dustin Patarnan at siya kung nitakiliman langaw mitaman na siya mapalalaw ng ngani kanuli taman na isa magabiyo kanila pala si maninga.
Staff are stretched. They're working really hard to do the contact tracing and maintain notifications and support people in isolation.
Kako kanayak ti amiga sila ilap tu takal ilap sutillo at suruti kay nang atalo tamak kuning katiyaw yumanin kaw isak pala hatta ng mo kaw yike hatta ng mulo tako alay kayo hatak sutani daily titaw yunik.
We've seen significant changes over the last few weeks that we've already discussed about. The first week or 2, it was tracking cases down amongst essential workers, some of which were new, some of which probably happened before April 14th. And now we are, much of the spread is the result of unsafe gatherings and spread into new households through those events.
Mana takhaw si malaki lakti wa asil jepalya ni si mayuni pinaso ako sigalaw si mayuni sa bulak pangalan ni tulya ni lo pinaso ako ngani takwa kaw sa tuwid na hatalaw tabot sulo kanaya ka kanlakit to ni katiya hakto miniyut ilangi time nuva jana tax mayumi miniyut sa yugalo April 14 tungani kasi ani liman takwa sa mapalya lang ataulo ka na automated silutias si minikati hatam ninginut tamakwalo sa mapalyaning inwasing inwilo may hatiging itamay no taman na isumalo tiging alak tabo.
In Mr. Kusugak's opening statements, he said that our short summer's getting shorter. I'm wondering if you can refresh our memory as to if cases stopped tomorrow, what's the timeline for returning to normal?
Kusugaw ka sa kakamataman na yago na ilivalyat sa tigilang ay kay tiga kay na tigo tayo malikaw pa nuwa joan na siya mapalyagon nita nakahangat ko tamak ko matiyak palyagon naksigayak ka kesa tuwin na.
So declaring the outbreak over, if that's what you mean, it's 28 days after the last case recovers. Taman na siya mapalya ni ani ko nganong pidyo te haro bita ko uloy 28 nalaw tillo kita na kingulak pa kan ay gunero te khalaw tillo. But there's ways to ease measures before then. In the past, we had the threshold we were looking for was reaching the point where we weren't recruiting new households on a regular basis.
Tako ajiging itutigun siamak tavalagum na tumalit tawialit so looking on it in tamakwa kilio hataksamayo tamakwa ilumio hatigi nutat siama palagum na ito akata taima kasuya valagum na sigayak tuwalwa.
We don't know yet if that's appropriate for the current situation where so many individuals have been vaccinated already, and there's going to be the opportunity to vaccinate teenagers in the next, hopefully as soon as possible, so that can also change our approach to the public health measures.
Kaya manang ito naman ang mga manayok asidya sa malang atako ame sunak sa kapiyaw sa malang tilugit ang malutako kapiyaw hataw nalalot tilugit ubikay man na manguyot sa uyugalwak tamakota asidya taw gutigun na kayang miya malitaw galin nuan na ham nang itulakin ang makasuyaw gunang ningin.
Trevor Wright, Nunavut News. You previously mentioned that people are refusing to get swabbed. I was just wondering if you could, I guess, go through the process of what happened when you have to get tested.
Trevor Wright, Nunavut News kung niyo hakaw gabilang hipilo katang atakaw isak taw gumayugal wa kanol itamakwato aktaw sungo batay makaw isak taw yuham niyak tilogo.
So there's a few options. If somebody's known to be a household contact or a high-risk contact, we have, in most cases, we have people who will go to them and swab them at home.
Wow, you're doing so good today. Sige ngito ni nalira ko titalita magkwaso lilo meo hatigi no katiyaw yo ham nakat uluga nak tumito ham nakalo nyang ikangangin no pakatakto.
For people who are have been identified as surveillance, or for people who for example, when we put out a public notice, like we did for some of the licensed facilities, they can call the hotline and make an appointment to get swabbed at the cadet hall.
Tamakwa nalo na taw sa mayo hawi sak taw ga hamning nik solo wilang itigo hawi kay hatak tugo kikutu nanik tusak dit siluta solo tay kwa imek bindi tay may hatayo gata tamakwa lo katiya haktu minyo so yo khala hatta hulutigo hawi sak taw gumalutik tay kununga ukhala begun naktunu.
And for people who are high risk, like we said on Wednesday, people who've attended parties in the last 2 or 3 weeks and are unable to contact the hotline, they can walk up to the cadet hall between 2 and 5 on weekday afternoons.
2 and 5?
Yes.
Tamakwa lolo anak tumin na sa yun solo imigala hatigay tuminiw yun ipardak tuminiw yun pinaswa ko si nimakko ni pingasuniw si mayo ukala kung nang ito ako titay ko ngayon pag utikat taon na to unalit sa yakala ilong ano ikakangin ni 2 ang malo 5 ako ni nga ni unusak ko.
More general health question, I guess. How are Inuit more or less at risk to COVID-19 or COVID-19 related complications?
Tana kanole Inuit tamako nuvadyo na 19 mo kanin madyo ako takaroon ng mga tadyong ito ba?
I'm not aware of any if you're looking for an answer in terms of genetics, I'm not aware of any research on that basis.
How mang ito tamakwa solo timitin ni autigo tamakwa yung ito takamnit tamit sa ano pidyo takawi.
What we do know is that individuals who live in poverty, in crowded housing, in food security, or have issues with food security, are more likely to get COVID-19 and more likely to have more severe infections.
Kasi nila kaya mayakalo aktigo tamako kikutuin na in solo ajorsartumil inuusiqartuut ubbalu illumiorratigi amisuutillugit umbaluuni neriatsaqatsiaqattangittu tamakku nuvatjuarnartaassaqaigunnaniqsauniqartaujun ammalu qanimmatjuaqutiqarneqartausu.
And we do know that those conditions are much higher frequency in Nunavut than they are compared to the national average. And so that creates those conditions where we've seen in Aviat and Iqaluit where COVID-19 spreads very rapidly once it gets introduced.
Haimajugu tamakkoa hanigutaujunartuinu sittinni amisuunersaammatatamaani nunavummi assinginni kanatamita kullugit tamakkoa saqqirutaussaqattangata taimaa takulortattinni arviani qalunnilu tammunnannuvajjuarnaq qilamialu sokattualummi taimaittumiitillugut siarmapalliagunningani.
Kent Driscoll, EPTN National News. Dr. Patterson, we haven't asked you about this in a couple of weeks. Wondering at what point will you be able to expand bubbles to include people who live by themselves, people who may have adult children living by themselves but would like to include them in a smaller household bubble? At what point can single people bubble with someone else?
Kent Driscoll, EPTN kunni makkunni pinasaarussiinna periaulorsumagunniaravitamakkoa suurlu illumiohattigingitamini assimini pulaareaqatiraqtarunnaqqa taakkuningatsainnaqqanga tamanna pigiarunnarsilaarsorivio.
I'd like to see some significant change in the frequency at which new houses are being recruited before we take that step.
Takugumagayaktunga taako asidjilaarilluti katatsimallaarilluti luqanutigi taako illumiuqattigi ajjigingittu siarmarbiuqattarunniirneqsaupata tamannaisumassarsiorutigi kunnarsiagayartavu.
The hesitation is because of the mixed message that it puts out when we ease measures in any way. And we can see that when, in reactions to when the numbers are looking good for a couple of days and people say things like, oh, we've turned a corner, and then the frequency of gatherings and the number of unsafe gatherings increases within a day or two, and the end result is we see more cases. So we need to do it in a fashion that doesn't give that mixed messaging.
Tamanneila ajonnartuuqku ila tukisinerluutaugunnarsiqattanga tamakkoa qasugiartaugeimma tamalittaugealiit qatsiuningi tamakkoa qatsiinnarukainnaqqattatillugi ulluunni maqquunni suurlu katatsimakainnatilugi kikkutuinna issumassaqattangata kata teeme saarmapalliagunniangaqqai amisuunersai katiqattasiqattangata ulureaqartumi titsilluti assimini taikua amissuurnguupallialaqissaqattartu taima qatsiinnaruupalliasoritsileraimata kisaani tamakkua qasujauballiagunnarsilaartu tukisinatsiartumi naluneertaussimaluni tamattumamissaanu.
Dr. Patterson, you mentioned earlier about vaccines for teens, and other jurisdictions have already started giving out vaccines to teenagers. What more can you tell us about that timeline? When are we expecting those vaccines? How long do you expect it to roll out in Iqaluit, and when could we possibly expect to see it outside of an affected area like Iqaluit?
Takoali kaputi uvikkarnu pidjutigillugi hanga pigialaarsorivigit assinginnili kanatami pigiarsimalriirngata hangakku pigialaaqaat ammalugu qanutigi tamanneqalunni kamagiyaugayaqqa.
We don't know yet when we'll have it available. The allocations for the rest of to take us to the end of June were set some time ago. There's been discussions with the federal government on accessing some Pfizer. We don't have anything confirmed. As soon as we do, we'll give as much information as we can.
Hayamangittugussuli tamakkua tunijaulortu vattinnu June nunguanu naammana simajaulaungata tamakkua aaqittaulorsuti uvatsiarukallagavamatoqakkunnu tunisiniarneralaarningi Pfizer minalunartuugaluar kisaaniirtusartitsitsautigajartuga tunisilaaliqqata.
Jackie McKay, CBC News. very bold messaging today about not gathering and parties. I just want to get a little bit more into what you're seeing and who you're talking about, and if you can define what you mean by parties. I'm just worried that maybe people listening are thinking, no, that's not me, because I'm just going to one other person's house, or there was only 10 people and that was a party. So can we just specify more on like what exactly you're asking people to stop doing?
Jake makeitan lalo na itseartu guhaus khallariqataarat sitamakua katiqattaxuyi ngitsusi imiralarhattartunilluuni katiqatigiaqattartunik tamanna lalo na irealaaru kikkunnuuqaut jigiaqi tamanna tukisinartigiaqu kisuumanga parties kikkunaalangimmata ilangitaimeetsoriyutsaangimmata taimeehattaqaluartillugi tamanna lalo na ireaqainnalangi.
Thanks, Jackie, and it's a good question, and my statement today was very specific about saying unsafe gatherings for that reason and to try and eliminate that confusion. So any kind of mixing between households indoors carries some risk of spreading COVID-19, and we've seen people gathering to celebrate Mother's Day and bringing 3 or 4 households together and contributing to spread. But we've also seen unsafe gatherings outdoors where people are in close proximity and not wearing masks. And so safe gatherings between households would be outdoors and wearing a mask. Safer, they're very low risk.
Hanutuina taako katikhattartu suulu illumio hatigiitinnagit illumio hatigit ngittu tamakko takollureanartumiitit sivunuvajjuanarmik saamma hatigiiqattartun qauiaqattarsimayugu katiyuminernianaana ullungani taakko pingassu sitamalluunni illumio hatigiingittu katiyumini ullutisearmalatsiyuminiit taakko alu takoqattartuguat ulureanartumiittuti katiqattartu silami matuarsimagati miligarsimagatillu Temali ulureanangittuku katiqattarunnartu silami matuarsimaluti kisiani silami kisiani.
And how much of the COVID transmission is accounting for unsafe gathering or contacts?
Hanutigi tamakko Nunavut searmarsima ulureanartumiinnikku searmartitsiqattanarmu.
The majority of cases are acquired that way. I can't remember the exact percentage right now, but it's that's accounting for more spread than the spread between essential workers or at correctional facilities.
Taakko amisuunersai teemaa searmahattartui teemaa ulureanartukku katiqatigiiqattarninginnuut prosentinga haujamangitaqaluanga kisaani amisuunerpaa teemaa searmartitsisimayu taakkua takullugaassingi suullu qinayaraaqallaritu ikayortauvinniittu.
On the transfer of the Canadian Press, we had 14 cases, then 8, 12, and 12 again today. Are those cases linked, or can you describe where they came from? Did they come from these unsafe gatherings?
Emma trying to Canadian Press kunni taakkua 14 uttalauqut 8, 12, 12. Taakko hanutuqaangani haqqa taakko searmabbiussima baulureanartumiittu tikatiqattarninginnu.
The majority are linked either directly or indirectly to those types of gatherings where people from multiple households get together indoors and not wearing masks, which provides COVID the opportunity to spread into 3 or 4 households. Then they become infectious at home and spread it to other people who were in the house who didn't attend the party and may not even have been aware that there was a party.
Tamakko atuaangani hartuamisuunersooju tamakkununga katiqatigiiqattartunuut suurlu illumio hatigiingittu iluani katiqattarninginnut matuarsimagatik tamanna searmarutaulariqattarsimayu suurlu Pingasunu sita maluni lumeo katigi ngituno sa magutaw le kataktor tay ko ilumino kami ng kamino asimino ilamino sa maksisitak ko party kataw law ngitu galwalo.
The next question is for the finance minister, please. We haven't talked about the isolation hubs in a while. I'm wondering, I know the GN did have a contract to run the hubs. Has that contract been renewed? And I know we're seeing people already traveling this summer. Will we see the isolation hub stay this summer?
Takwa kalluna ni tuyo mi bi ani tele bi kay na hatak to pidyo tigilo ino na buga ba makko contract hat ti yung matawla taon ngino. Takwa ya aw lahat talalak to sa metatakwa suli matuing alaka.
Thanks, Emma. And I'm sure, as you can imagine, this is always a fluid scenario of how long these hubs are going to be in place, based upon the advice from Dr. Patterson and his team. As we go into the summer months, our current contracts are in place until the end of June, which will continue to evaluate how long we're going to need these hubs in place. When we look at vaccination rates and a number of different scenarios and active cases, it obviously has a lot of play in it. So I can't give you a timeline, but we do have our contracts in place with the airlines and the hubs till the end of June.
Taman nila sidjak tayo nang hano pidyo tiyaw ni nga tanam luta Patterson malitaw ko yang malitaw it aw yaw ni akte mutan na contract June nungwano atane akto galo kisay na kayo sakpalang na nakta mo hano tigya kam na mga hano tigi hatsi kapayaw si mga ata hano tigi lunwad jo anak to kam mga kisay na hangak ko kayang ni nga ninaluna si simangit to nga kisay ni tako contract hap to June nungwano hanga tayo lirayino amalo to yung mebinno.
This may be a question for Dr. Patterson, but maybe a question for Mr. Kusugak. Dustin Patarno, NCF News. Was schools currently at stage 4, food programs are operated at the CPHO's discretion. Can you say whether or not food programs are still ongoing at the schools, and if not, what's being done to help facilitate that?
Dustin Patarno, tako ilin na bi matuyaw si maningan nalo na ikuta formi mata kanili ko ta mga tataman na nalo na kaya akong nakyo.
I honestly don't know. That might be a better question for Department of Education. I know in previous times where we've closed the schools, they've been able to continue those programs, and I would certainly support that to reduce the impact this has on food security.
Kaya mangit na wata ko ilin na nila ka pero nga ako biya ka na sa gayak to kistani kingunit ni matuyaw gay matata ko kayo stita katalok to na ritit sa hatta ko tiyo tay mana riyak sa katsa ako yigalo akatta sule.
Based on the data released on Wednesday, approximately 34% of eligible adults in the territory that can get a vaccine haven't. Wondering what you can tell us a little bit about what you know about vaccine hesitancy.
Pingat sa mita ko 34% ni Nunavut mute kapiyaw si mangin na to long ata hanulik kaya taman kapiyaw ko makatang ito hanuis lalo na kaya akong nakyo.
Well, certainly it's a problem for every jurisdiction or many jurisdictions, but it's really important to not generalize. Each person may have their own reasons for not getting the vaccine. Sometimes there's lots of reasons, and I'll let Uli interpret that part and then get into it a bit.
Tana kaungili ko tayo katato na mitiyo na bito si mabiyo yun kasi ni pimario buta ko ilo nangin nite ma ukaw sa kaya hangin nitin ni kikuli mga ato ni pidyo ti hangata sumakapiyaw katangin mga ata misrilo pidyo ti kakto ni.
There's a lot of incorrect information and a lot of misinformation about the vaccines, and so we work to counteract that as much as possible. We reduce barriers to getting vaccinated as much as possible. and continue to work with people, or many healthcare providers are continuing to work with people one-on-one by bringing it up at regular healthcare appointments and encouraging people to get vaccinated, even if they can't right at that moment, to make appointments and get it taken care of.
Taimala sulingituni kammalo tamassima yuni tusatsani taima tuina yo hanga tamannattao khipilula khilirutao hattanga kisani suliyuni sakhir siga swangin nakaluartugu tukisijjutao yunnartunik taakwalo atuina utitauga kannerni kaputit ilagiyaulluni taakwalo anna hannangittuleri jivu qana yakhatikhainartu anna bila khattartuni kapiyaw khattakhuyillutik Trevor
at Nunavut News. How many fines have you guys issued, and how many complaints have you guys received about breaking public health orders and whatnot?
Trevor at Nunavut News. Kunni hatserti akili titaw yu hasmale kaubalo hatserti unirlu tuha hattasma ba khumitsi yuni.
There's actually no update right now.
Thank you, and I appreciate the question. While I don't have numbers, I do want to just let people know that, again, like I'd mentioned earlier, when people call into the RCMP, to use a triaging discretion to make sure that it is an urgent nature. We do get a final report from bylaw and from the Sheriff's Office to our COVID response team, to the enforcement team on numbers and issues. So we'll continue to track that information, and going forward, I'll probably have a better idea of actual numbers. Trevor, thanks.
Tako hatsunin na hayo mangitugalo ay kisani tayo mauhakaw mapalisik ko pimariw na sanisipuliw jiga kakatangata tuwabang nangito akatalo kamagung na hatasutik tako alo baila aleriji tamalo kaptevi mi palising ngoat tako alo novadjo naktuleriji kamayinot tako hayo sakta balangin nam na ato amalo hatsunin in kaya hayo katagun naksila halo aktusi.
Do you have an update on the situation at BCC or the Elders Home?
For the Elders Home, there's still just the one case linked to the Elder Center. Sorry. And for BCC, or for the corrections facilities, it's 14 people.
BCC, mi kayok tawin mi 14.
Minister Kusugak, please. Ken Driscoll, APTN National News. Minister Kusugak, back when the Elders Home here in Iqaluit was closed, I've heard since that possibly the board has been changed behind the Elders Home. I'm wondering, is the Elders Home under the same management as it was prior to the COVID outbreak shutting it down?
Kentrisko APTN kunni Minister Kusugata namatuyo launganin nakubita kwa katimajin asijirsimalangata takwa olatsiji asijirsimalangata.
Kuya nami tapsing apirigabit. Taman pilari ya lauraptigu taman teikunga nubagjaani siambalauk tinnagu teikani aulatsi lauktut timigi yanga aulatsi yumayunni laumat maanna qinartugut angi qatigigu tiksamig asianik timimig aulatau yunnaqsiqublugu. Before COVID hit the case at the Elders facility, we were in discussions with ending our current contract with the body that is there to run it, and we are in the midst of finding a new body or to run the facility. So we're at that stage right now. If I can just add to that, while the facility is not manned, we are also working on making some minor renovations to the place before the elders come back, and we should have a new management body in place before the elders come back to the facility. So this gives us an opportunity to do that too. Taiko ino to kai utilaw ngin ni taiko nga pilarik kanya dunia mai utau ilunga akik so lugo salom maksak lugo piusigyar lugo amanutami timimig awla chiyo kalak niaktuk sayo taiko ino to kai man na taiko ning itu taiko nga utilaw tinagi.
Just to follow up on that, is there any concern that switching providers partway through this COVID crisis is going to lengthen the amount of time the elders' home is closed?
Kuyan na may kanita sa mga apirigawin. Matuwing nasang nagsawala tin nasudyang itiyaktabun. Inutukay ang ikaring magu, inutukay tayo kung utaktit tumayabut utirun naksitwak pata. Tamakwa pilagayari niyaktabun. Tayo kwa utilaw ngin inidlak si matya tiyang niyaktabun. Awlak si magkan ni kutakong innaptigut taman na pityo tigilugo. The plan is and has always been to bring our elders back into that facility as early as possible. And we're working diligently to make sure that when the elders' time to come back is at such time that we will have worked out all those issues so that they come back in a timely manner. That's our goal.
And just a quick correction on the numbers from the correctional facility. There's been 14 cases in total, but they've had some recoveries, and it's now, the current number is that there's 10 cases of active COVID associated with correctional facilities.
Tana kaya kay nang lugo kausri kaya ng ikayok daw bimi 14 unira kaya ng ikatilugi kisani ano igun nito kasmalang huli ulit tumana no vadyo anak tuli sa makotaw yung naktumi.
Apologies for any confusion, Mami Anak. Ilan niyak to nga.
Jackie McKay, CBC News. My question's for the Justice Minister. Could you update us on COVID in the correctional facilities? Is there any more information about how it got in, and has it impacted staff and services to that facility?
Jackie McKay, CBC kung ni maligalig kung minister ta na vadyo na kanu isang ng mga ikayok daw bimo amalo kanu at tuwing nakasama ba kanayak tingin no tigo yaw sa mayon.
Thanks, Jackie. And like we'd mentioned with the very first case, it was during the intake process and testing that was identified. Subsequently, there has been other positive cases that were identified. We don't know the exact source. I know through contact tracing, there was a number of people put in isolation. So it did have an impact on staffing. Again, a silver lining, if you want to call it that, is the Baffin Correctional Center didn't have inmates in it at the time. So it allowed us to get ahead and have additional space. We're still through the contact tracing, and I know Dr. Patterson and his team is working with our in-house health people to track stuff down. We may never know exactly how it got in, but we do know the original case was identified through the intake process.
Hello, ngayon lahat ko tigo yo wala tilu ya hawi sakta hatta ngata tema tigo yo kata mi hawi sakta tilu gutana nalu na to laos mamma takwalo aniteli titaw chaw tigilak tuting taman nato ina ha simayo galo kana yak tino kisani kayok taw mi bisi si mita ko ino halaw ngim tema ulak titaw ngata kallo na no ina halaw ngata man nakaw na ko taw lilaw ngat amaluelang inalo na ito si maluti kati yaw yuminang nakaw isak tiluwi dat si maluta Patterson kanayak tingilo kasi nakaw yung malaw si madjayot sa Iqaluit tigo kanok taman na isang ng mga.
If I can add, Jackie, just with the close contacts, obviously through the health orders, other staff members would have to isolate until they're cleared. So it has created a challenge. I will say that the staff that are on duty are in full PPE, the gowns, the masks, the face shields, the little booties, the whole bit, to make sure that any further transmission does not occur.
Ana hamnang itulari ng mamalitaw gali malitaw laki mata kanayak tilo tamakoi lang kanayak unay sumayugalo anit teliga hamningin nun kisani mana kanayak to ta ko atang yat ni timi minut sa podi yago tinato inakatak to so lumiligas sumanlo ti timi limangalo tama atok sutite may tuni.
When we were first told about this, we were told that one case was an intake, somebody who was identified through intake, and the others were the general population of Nakigarvik. So that doesn't feel entirely accurate, that we don't know, or I think what my question is more about, have we found any more about how it entered that general population? If those people are in prison and they haven't gone anywhere, do we know more about that?
Tana siguro pa may kausi utilugo tigo jaw balla yami kawi sakta miniko kawi sakta ulong ilang ilo makigabim mito ilang ilo tigo jaw simayo tai ko kano kawi naktut saw galo ngata ko tigo jaw simamata namung jaga tilo taman na kawi majaw ga hatut saw yu galo.
Thanks, Jackie, and I do apologize if it's unclear. Again, we may never know exactly how it got into the inmate population. You have to remember that before COVID was actually in Iqaluit, there were still work programs where inmates were working around the community on different things. There was limited visitation, but there was still some in-person visitation going on. The intake process wasn't quite as tight because there wasn't an active COVID case in the community. So again, I don't mean to be vague, there is a possibility that we may never know exactly how it got in there. It's more of dealing with it that it is in there.
Tako ngila kawi malaw simadyang itapukano tako tigo yaw simayuno sang mapalalang ng mga tako ano wadyanak 19 takalaw tinago ilang isulik kanaya ka hatta yung matatamaw ng kalunununalingano ilang ilo pulari aktaw hatta kay na yut pulari aktaw hatta yut sutik no wadyanak takalaw nginingan ni amalo kawi saktaw siyang inaksaw hatta yung mata mamaya na taman na cute siyang itakalaw kakisani kawi malaw simadyabal lang inatakano tapi kung nga isang ng mga